Good morning and welcome to Indiana Ship's Medicare Monday. So today's topic is women in healthcare. And I am Melanie Garland, and I am joined by my two lovely co-hosts, Susan Spilly and Megan Rogers. And we have a fourth face with us this morning, and this is our special guest. So today we are joined by Nancy Moore, the program director at Senior Medicare Patrol within Indiana Association of Area Agencies on Aging. And we just discussed that's a mouthful, but that also stands for I4A because it's a lot easier to understand. So if you're in the biz, that may be what you have heard it referred to as. But we want Nancy to join us today, and we want to make sure that we honor Women's History Month this month in March. And Nancy's going to talk about her journey career-wise and what led her to where she is today and kind of what got her started all in the beginning. And that also acknowledges the Disability Awareness Month that March is as well. So we're kind of hitting both topics today, and we're very lucky to have Nancy join us and to acknowledge the special awarenesses that March honors. And, girls, it's just great to be together this morning, and we're kind of celebrating Women's International Day was on March 8th. So this was when we could get together and celebrate that. So we're kind of doing that too. So without further ado, I'm going to stop rambling on and let Nancy take it from here. So thanks again for joining us today.
Okay, thanks, Melanie. I appreciate the opportunity, and it's quite the honor. And again, I'm the Senior Medicare Patrol Director here at I4A. And we, just so in case you don't know, we're kind of the best kept secret. SMP helps people, every state has one, and we can help you with any kind of Medicare fraud or abuse or potential fraud or abuse situation you have. Or if you have a group that would like a presentation, we're here for that as well. And of course, we cover the entire state, and we just love to spread the word. We work with SHIP closely because it might be more of a SHIP issue. You need to talk to them, but we're here to kind of ferret that out. And how I was just telling everyone earlier, the reason I got into this healthcare or, advocacy for folks was because my son was born with a very rare condition that requires he be on a ventilator when he sleeps. He was also premature. And Melanie's going to bring up a picture of that's when he was 5 years old, welcoming his baby sister. He had a trach until he was 8, and he still sleeps with a machine, a BiPAP machine that, actually it's life support in his case. But what I was saying, I have a degree in fine arts from IU. I did administrative work before Matt was born, but then after he came along, really the hardest thing was understanding health insurance and, Medicaid. And of course now for those with disabilities, they can access Medicare. But that really kind of set the tone for me. I worked for actually when I was at home with Matt, because it was basically impossible to work. He had full-time nursing at night, so I could sleep till he was about 2.5. And then we stopped that because it's real invasive to have people in your home all the time. They were great, but we had luckily Matt, very healthy, just has this rare condition when he sleeps, he underbreathes to the point of needing life support. And the fact that he was premature was a bonus because they caught it from the beginning, so he didn't suffer any damage. But anyway, I did a lot of volunteer work when I was home with him, and then his little sister came along later. And I worked, actually was on the board of About Special Kids And then I worked for them for a number of years. And we had a federal grant there as well that helped families navigate insurance and Medicaid in particular, and Medicaid waivers specifically. My father and I, before Indiana even had a Medicaid waiver, which is now the aged and disabled waiver, my dad and I testified to the state Senate that, people need this. This is to keep people out of institutional settings and provide them the support they need, even if they have decent insurance. But as we know, insurance is always changing. And even 35 years ago, it was, there were high copays and deductibles and that kind of thing. So that got me really into this work. I was lucky enough in 2013, I applied for this position here at I4A. And so I'm still helping people with disabilities. In fact, got a call from a mom that I worked with, she's the caregiver of, she has two sons with pretty significant autism. She had gotten a letter this last week from Social Security. She thought it was a scam. We've trained people so much that things are scams that I helped her she sent me a copy, and I said, no, I think this is legit. You need to call Social Security. And it ended up being a legit letter. And of course, she was on the phone for an hour because Social Security's, their offices aren't open, and it's still somewhat difficult, and they're understaffed. But anyway, so we're still helping people with disabilities. We really want to help people that are on Medicare, no matter what, or their caregivers, the people that, people like you guys, or like me, if my parents were still living, who would be helping them figure this all out. So often we get calls, the caregiver may live in a different state, but their mom is here and is falling, receiving all kinds of spam calls. And so we just help them figure out how to better protect them and detect any potential, read your Medicare summary notices, right? And I know that's like, I said that to a friend of mine who's a CPA one time. His parents were both getting care in the home. And he's like, I don't understand that. He's a CPA, So I'm like, yeah, you can figure it out. You just have to, take a little time with it. But so we're here to help people do that. Trying to think what else. I think we have, a real good network of folks. Of course, I reached out to Sharo Boyd when I was having this issue with a friend with Social Security. We've got SHIP can always help us if we're not sure, not sure what Medicare covers or what are the rules and regs on this and that. And so we have a real nice, we want people to get the right resource at the right time at the right agency, instead of, now I didn't quite do this, but a colleague of mine who worked at ASTED, and she has a social work degree, and she said she called 52 agencies before she could get help for her son. I called a few, maybe not 52, but I remember back in the day when Matt was born, I called March Dimes because you figure, well, they don't do any direct service, we didn't get any services through the area agencies on aging, but of course by the time, we were able to access a Medicaid waiver, the aged and disabled, which used to be medically fragile children's waiver. Matt didn't really need that. He's a young adult, if you want to show his picture. Well, he's not even that young anymore. He's turned 36 last week. So that's why this was real appropriate to kind of talk about how I got into this. I have a degree in fine arts. Who knew I would do, advocacy and helping people understand insurance? It's like death, taxes, and insurance, so it really not exactly the most fun things in the world, but you need to know when you need to know, what's covered, what you can rely on. And so we really appreciate our relationship with SHIP. So that's my background.
So Nancy, it seems like, you did the mother thing and you hunted down resources to help you with your baby. And Matt, by the way, as a young man, looks like he's very healthy and he's a good looking young man. And I know you're very proud of him. But back then, being a new mom with a baby with disabilities, how did you join support groups, or how did you deal with that? It's such an alone kind of situation.
It really is, Susan. Good question, because the specialist that Riley told us at the time, he was one of 50 in the world. And so talk about feeling alone. So I joined a group called, I don't think it's still in existence, but it was a neonatal support group called Neophyte. I don't know if you ever bought any flowers from them, or we had a poinsettia sale in the winter, and around the holidays, and then we had spring flower sale, and I became kind of the main person on that, and just have really good lifelong friends still to this day from that group. One whose son was born without arms and legs, and he's another young adult working and doing amazing things, and another friend whose son was born he was also premature and has he has some developmental disabilities and some medical issues. So, it's amazing. That's how I connected, not necessarily the exact same problem, but just another family who's kind of navigating these same kind of things. And then later about special kids, which is now called Indiana Family to Family. We all of us worked for them. So, we became quite close and still are to this day. So,
yeah, that's great to hear that even 36 years ago, there was a network for parents whose kids had special needs. So how did you find the services? Was it through the Neophyte group?
Yes. And I think we promote this too, your fellow people going through the same thing, whether it be, new to Medicare, talk to your friends, but talk to really trained people, like people at SHIP that are not selling anything, that are trained in all the ways that you can find out which program is best for you, because it's very complex. But for services and things like that, for older adults, it goes the same for having a child with a disability, talking to kind of those natural resource supports that maybe isn't on the internet or on a listserv, and just finding that, how you can get support through the schools, through community groups, through other agencies.
Thank you.
Any other questions or comments?
We do have our Milestone followers, Sean Swindell, wishing us all a good morning. And we always appreciate Sean joining us on our Facebook Lives. And Sean also is a mom. And I think with a son that's probably close to Matt's age, a couple of sons. So I think as a mom, we don't know how you feel and we don't know your struggles, but we certainly know how it feels to be a mom.
Yeah, definitely. it's, I think, knowledge is power. And like I said, one of the more difficult things, I mean, I learned how to take care of a kid on a ventilator, a baby. We had like a mini ICU in his bedroom, and we did have home care nursing. We were on Medicaid disability for a while. The waiver wasn't available. We did have a large spend down, but the most difficult was finding, the insurance, navigating the insurance, because, you got a lot of denials for things, and knowing how to like exhaust your appeal rights and, ask the doctor to help you navigate or, advocate for you. That really helps. And I think especially people who are, in any kind of crisis like hospice and they haven't, Medicare, they need to have some information because knowledge is power. So I felt like, and of course on the medical side too, you want to understand what the condition is and how to best, treat it and that kind of thing. But insurance is a whole separate ball of wax, as you all know. So I think that's was really helpful to be able to, know what I could ask for. But also it takes a lot of time, and I'm glad that I've been able to help other people. I think so many of the folks I talked to, like I had a man the other day, well, a couple of months ago, his wife was dying of cancer, and he was getting all these supplies that he didn't need. And I thought that was good that even in the midst of his crisis, he looked to be a conscientious consumer. And I felt like that too. I didn't want to overuse something just because I could, I think we all need to know that, healthcare is expensive, and we want to be good consumers and use what we need, but not, order too many supplies or know where to put those extra supplies if you do end up with extras.
Yeah.
Just all those resources.
So it really sounds like, you might not have wanted to have to be such a strong advocate for your child, but you were forced into that role. But, that experience with Matt, especially because he's a healthy young man, doing his own thing now, that advocacy hat that you had to wear all those years really prepared you for being the SMP director and helping Medicare beneficiaries figure out what's what. Because we, as SHIP counselors, we wear an advocate hat as well. And yours came from, a personal place all those years ago. So along with the SMP thing, so do you recruit volunteers? Do you have a role for volunteers in your program?
We do. Where the program is predicated on using volunteers, and we work with a lot of SHIP volunteer, that they're both SHIP and SMP, because I do think, especially if you want to give presentations, we have roles like giving presentations, being, at the exhibitor booths, helping with administrative tasks, and we use all the area agencies on aging promote SMP, but all but 3 have direct responsibilities for doing outreach, presentations, and one-on-one counseling. So a lot of the times, we farm that out, so to speak, to the local area agency on aging. And also we work with 4 senior centers, because we want to meet people where they are and where they feel comfortable and where they trust people. It's so hard anymore. Like I said, this woman thought the Social Security letter was a scam. I mean, I can see why, because we're just inundated with the spam calls and the emails and texts and phone calls, and even sometimes mailings. So yeah, we use volunteers, definitely. And if you're interested, give us a call at 317-205-9201. And
We will
direct
put
you.
that in the comments
Okay,
too.
good. Okay, good.
Absolutely.
And is that the same number that you use if people think that they may be getting scammed on their Medicare?
No, we have an 800 number, toll-free number, which is 800-986-3505. And that would direct you to the local area agency on aging for your county. So, and you just tell them you have a potential Medicare fraud, or abuse situation. Sometimes things are quality of care in Medicare. It's maybe not fraud. So there is an agency, it's called Levanta. It's a national federal Medicare contractor that we can refer you to. Or it may just be, communications. There's multiple reasons. The consumer may think it's fraud, but it's really not. The price of things blow people's minds, and that's not fraud. That's just how healthcare is expensive.
Yeah.
Yeah.
It's great that I always like with SHIP, we're set up with local agencies as well. And when you're talking about things like insurance, or you're talking about things like, a potential fraud or identity theft or a letter that you don't understand. And in this day and age, we are, very on, alarm with those potential scams and things that we don't understand. So I think it's great that the Senior Medicare Patrol is set up with those local agencies. And like you said, meeting people where they're at, because you can feel really alone or uneducated in those moments. And it's nice, even if it's not a potential, fraudulent billing or something, it's nice to be able to sit down and talk to someone who can reassure you. I think that reassurance is just key in a lot of these, whether it's picking out a new Medicare plan when you turn 65 or when you become eligible for Medicare due to a disability, or if it's understanding a letter that you get and making sure that it's right, because those scams are getting smarter and smarter and harder to, verify what's real. Like your friend, where it was a social security letter, like I get it. So it's just great. I just wanted to say that it's just great that how that is offered to the public, to where you can get that reassurance from a local person that
Yes. Because oftentimes older adults, they don't want to bother their children, their adult children, or they don't want to let people know if they have become, have been victimized. Because, I don't like to tell people when I do something that, and oftentimes they realize as soon as they give that Medicare number out, oh, I shouldn't have done that. Why did I do that? But I will say this, these scammers are getting so crafty. I had a medical test at St. Vincent's here in Indianapolis, and that within 2 hours, I got a call from the main number at St. V's. And I know it just because I've had a lot of people at St. Vincent's over the years. And, I knew that 338-2345, that's their main number. And so I picked it up. I normally don't pick up unknown calls, that aren't in my phone. Well, guess what? It was the genetic testing scam. And that is really prevalent. It was actual cardiogenetic testing. I asked the woman, what's the name of the company? Oh, it's genetic testing. Oh, really? And then I asked her what's the address of this company? And she said, of course, Medicare covers it. She started on her spiel. And I said, well, what's the name of the company? Well, she just said, or what's the address? Indianapolis, Indiana. And she couldn't say Indianapolis, So it was definitely a scam. I do think there's some shenanigans going on. It's St. Patrick's Day coming up. I mean, how do they, and people tell me this all the time, I just got home from the pharmacy, or I just got home from, or just got out of rehab, or just got out of the hospital. And I always thought, oh, it's, coincidental. I'm thinking there might be more of a connection. They say organized crime is involved in Medicare fraud. They estimate, I mean, it's improper payments, really. It's not fraud, all of it. Some of it, Medicare, pays things if it looks good on paper. And they have an obligation to pay things in a certain time period. So it may have to be, if it's a double billing, that can be corrected on your Medicare statement. So there is, with the advent of technology assisted fraud is really, Medicare is in the thick of that too. So we just all have to be extra wary and careful about giving out any information or even answering the phone. I mean, unfortunately, it's gotten to, you can't trust the number on your phone. So happy news, right? Yeah.
Well, it's always good to have some information about what to do, and to be cautious about answering your phone. And if you do slip up and engage with somebody on the phone, and if it doesn't seem right, just hang up.
Exactly. And call your local area agency on aging, call SHIP, call us, call SMP. We're here to help you figure it out. I mean, it is disconcerting, when you get a call right after you had a medical test. You thought, because doctors never, I always say this, doctors never call me, or their offices. They don't use the number I've got in my phone. So sometimes you have to pick up the phone. You've got somebody in the hospital, you've got test results you're waiting on, you've got, somebody in hospice. You can't be that selective. It's time sensitive, but if you can avoid it, let it go to voicemail, pick, if it's legit, even some of the scammers are leaving voicemails now. So you have to be careful on that too. Just call a trusted entity, call a friend, don't act under pressure, don't act now. Nothing is, the government is never going to, Medicare is not going to call you about your benefits unless you're in conversation with them on something. So just know that most of the communication will be by mail, unless you have a Medicare.gov. It's a time to promote that. It's great to have those portals to check things, especially if you're a caregiver and you live 3 states away. You can check on your parents' Medicare program, make sure they're not getting billed twice, or, make sure that they're receiving the services they need. Through that Medicare.gov, you sign up and you have a ID and password. And that's a real good way to make sure, especially if your parent or loved one is getting a lot of scam calls and end up getting back braces and knee braces, for example, that's still going on. That are they're fraudulent.
Yeah, that's some good advice, Nancy. And I would just say that if you're out there in Facebook land and you're a member of a group who might want a presentation on fraud, Medicare fraud, anything Medicare, both SHIP and SMP are happy to come out to your location and do a presentation. So thanks for sharing with us today about your personal journey and some about your agency and what it does, and some tips and tricks to avoid being taken advantage of. So I think we're just going to head to what's coming up on our Facebook Lives. Megan, what's happening here in the next couple of weeks?
Yes, thank you, Susan. And thank you, Nancy, for coming on and sharing your experience with your son and your advocacy. I'm a caregiver for my parents, so I understand the advocacy piece and trying to I've been in the business of working with seniors for the last 11 years. And when I had to be their caregiver 6 years ago and navigate everything, I was still overwhelmed and confused by it all. So, it just thank you again for sharing your story and what you do with Senior Medicare Patrol. I've taught my father with dementia to hang up on all the Medicare people that call that are trying to get him on something he's already got. Um, but if you need help with your insurance or you have questions about your Medicare, give us a call at SHIP 1-800-452-4800. You can go to our webpage and follow us on social media. Even if you don't know we're the right people to call, because it can be hard to know who to call for your questions, just give us a call. And if we're not the right people, we can refer you to your area agency on aging, Social Security, or Senior Medicare Patrol. That's something that we do every day. We're familiar with those different programs, and we're going to get you to the right folks. So please don't hesitate to give us a call. We're there to help you. And then what we have coming up is next Monday, we will be back here again, and we have a special presentation on preventative care under your Medicare services in Spanish. Our lovely SHIP counselors at HealthLink are going to be here presenting to you on your preventative care. So that will be a great topic. So if you know anyone who would benefit from a presentation and hearing it in Spanish, please share the news, spread the wealth. And then because it's Disability Month, we will be here on the 28th talking about your Medicare eligibility and coverage when you are on Social Security disability and under the age of 65. So tune in. We've got some great presentations coming up the next 2 Mondays in March. So thank you again, everyone, for joining in. Thank you again, Nancy, and we will see you back here next Monday.
Great. Thank you. Bye-bye.
Bye-bye. Have a great week.
Bye.
You too. Bye-bye.